My name is Maria Rigopoulou. I'm a nutritional therapist specializing in bone health and nutrigenomics. And tonight I'm really excited because I'm going to talk a little bit about something that, it's really my passion and totally changed my life, which is about using nutrigenomics in practice. So the discussion today is mainly for practitioners and health professionals that use nutrigenomics in their practice or want to use nutrigenomics in their practice. But of course, everybody else can also join. They might also, get an understanding of the kind of work that we do. So today, lovely Amanda from Genomic Kitchen is going to join me. And Amanda, she's been educating and mentoring practitioners, doctors, pharmacists for many, many years. She runs her programs and her retreats as well.
Here I am.
We made it. Well,
we did. Thank you.
Right, that's okay. It always takes a little bit of time to connect with the other person anyway, so I've noticed from other times. So welcome, and you join us from Colorado, right?
Western Colorado. Yep.
Yeah. It's beautiful there. I've never been there, but I know it's beautiful.
Come on over. This is the best time of the year because we are high desert. So that doesn't mean a lot to a lot of people, but we are, let's say, just under 5,000 feet. So what, 2,500 meters, 2,000 meters or so. So high. But it's a desert landscape, but we can see the Rocky Mountains. So from my house, I can be skiing in 45 minutes or I can be canyoneering in 30 minutes or be on the Colorado River. So it's amazing.
Lucky you. So thank you very much for doing this today. I'm really, really excited about the discussion we're having today because we're going to talk about nutrigenomics and how we use them, how we have been using them in practice. The reason, what actually triggered the conversation, the need for the conversation is because we both see, I think, professionals that do a lot of training and they invest a lot of their time and a lot of money in a lot of different trainings and courses about nutrigenomics, but they still struggle in practice to implement them and use them successfully. But before we start, what was the reason why you started using nutrigenomics in your practice? What kept you interested in the first place?
Interestingly enough, I happened to be in South Africa, of all things, at a conference presenting. I think it was mostly dietitians at that point in time. And in the audience was the great Yael Joffe, who was the chief science officer for 3X4, which had not been founded at the time. And I think she heard me speak and she saw some of the work I've been doing in mapping. So mapping so that clinicians could rapidly understand a lot of concepts. We deal with a lot of concepts at any one time. And she said, oh my gosh, the way you think, the way you map things and ideas clinically and scientifically, I think you should take a look at nutrigenomics and nutrigenetics. This would be your field. So that's how I got into it. She taught me alongside the great Christine Houghton in Australia, and I have probably two of the best mentors in nutrigenetics and nutritional biochemistry, I think, in the world at that time who are active clinically. So that's how I started. I was lucky.
Well, that's really amazing. I didn't actually know about this story. So yeah, it's really fascinating. For me, it was a personal story because I had a lot of health issues. I was just trying to solve them myself, as I do, never asking for help. So this is what got me into nutrigenomics, but I also had some scientific background before that in biochemistry, and that also helped a lot with, like you said, mapping and understanding the science about that.
Exactly.
I think before we get to, using into the practice and what the problems are, it would also be helpful to identify or clarify the difference between nutrigenetics and nutrigenomics, which is something that you actually reminded me today as I was reading some of the stuff that, some of the exchanges we had over email, because this is something that we're also getting very confused as practitioners sometimes.
Mm-hmm. We do. And I think because the terms have been used interchangeably, probably more like 10, 15 years ago, when the science wasn't that the science wasn't there, it's when we started to see testing come out, right? And you've been in the field quite a long time too. And at the time, I think, a lot of companies were offering or saying they were offering nutrigenomic testing, when in fact they were offering nutrigenetic testing, which is really what you and I are using, right? Would you agree that we are using nutrigenetic tests, which I'll define nutrigenetics and you do the nutrigenomics, right? And then we hear both of our voices. But, nutrigenetics really, in a simple term, because we have to explain this to the public too, really it's a field of science that sits under genomics, just like nutrigenomics, but it really looks at how genes impact, I would say, nutrient utilization, if you will. That's the best way. So how does that gene optimize or interfere with how your body absorbs or utilizes vitamin D, for example, or vitamin B, B12. Let's pick B12 and be specific. So that's how I like to define nutrigenetics. And that's really what we're looking at when we're reading reports. Would you add any other nuance to that?
I mean, I absolutely agree. So the tests actually that we use, most of the practitioners use, are nutrigenetics tests, because they give us the information of how genes influence nutrients. I mean, that's simply said, what you actually can find. But nutrigenomics also involves the notion of epigenetics. So what actually we do as practitioners. So by reading the nutrigenetics test, we use nutrigenomics. So meaning we use nutrition and environmental, inputs,
management, nuances,
management, to influence the expression of these genes. So we can't really change the DNA, but change the expression. And what we do by changing, to change the expression based on the information that we receive from the test, this is what the nutrigenomics, I think fits better, the nutrigenomics idea. So it's not exactly the opposite, but it's not exactly the same as well. So, and sometimes it's confusing.
Yeah. It's almost like we use nutrigenomics, which is the information from the environment. Well, actually, with Nutri, it's the information from foods we use. We would say it's a ligand or a trigger or a signaling piece of information to a gene to do its work, to optimize it, sometimes to work around it. So that's where the Mediterranean. You're in Athens right now. Are you in Greece or the UK?
I am in Athens. Yes, I've been traveling quite a lot the last few months. But sometimes I really have to ask myself, where am I now?
Where's Waldo?
I'm in Athens. Yeah.
But when you think about it, I think, and you may agree too, that, we throw around this idea of the Mediterranean diet all the time. And you and I sit there and think, okay, which continent, which country are we talking about? Where in the country? Are you by the ocean? You're in a city? Are you rural? Because so much of the Mediterranean is rural. But I think, to me, the Mediterranean diet is probably the best example of nutrigenomics in action, because so much of the information, the olives, the olive oil, the pomegranate, the dictymus, the herbs and the flora and the fauna, is information that is sending signals to our genes to operate this way or that way. And I think that's really the truth, the scientific truth of the Mediterranean diet.
And actually, now that you mentioned in the Mediterranean diet, what I noticed, because the last 5 years, so I spent most of my time in Athens, speaking about Greece specifically, is the quality of the food does make a difference. Well, it makes a difference in the taste, how it tastes, but it also makes difference in the signaling. And I haven't felt that immediately, but after 5 years, I can definitely say that for sure I can notice the difference in how I feel and how I look and how I sleep and absolutely everything. And sleep is a weakness of mine. We discussed this before.
I'm talking to you at interesting times.
Yeah, for sure. But I've seen the improvement, and I'm glad that you mentioned that. in my opinion, since, you know, if we have to compare like different diets or cultures or whatever you want to call it, I think the Japanese diet is also very interesting. And, you know, for my personal, you know, what I use on a day-to-day basis is probably a combination of Mediterranean and Japanese, you know, flavors or taste, or because I think, well, first of all, it's kind of the, you know, kind of taste that I like. But in terms of what you said, information that they're sending to our genes, to our bodies, what is used, the different flavors, the herbs, you know, it's absolutely the best combination. Maybe closer, I would say, than to Mediterranean. Well, in Mediterranean, you also include, yeah, Italian, for example, as well.
Of course, it's
Yeah,
different. But
yeah, Italian, and I remember now some Portuguese recipes as well. They're absolutely wonderful. And then, of course, you have, you know, the Spanish tapas and everything, which, you know, are amazing, and they taste great as well. How, I mean, what is the difference that makes or can make nutrigenomics to somebody's practice? And, you know, if we talk about personalized nutrition, because this is, I remember when I was studying in the Institute for Optimum Nutrition, and we were talking about personalization and looking at the whole picture, you know, the whole person, and tailoring everything to their needs. How we can do that um, with a lot of precision and a lot of confidence. Which sometimes, you know, as nutritionists, especially when you start, I guess you might be lacking confidence. How do we do that by using nutrigenomics? And how do you do that in your practice?
yeah, I mean, for my practice, you literally cannot see me without me having your DNA blueprint. I mean, that is how you walk in the door with me. I don't see you without that, because to me, that is your we call it a wireframe. That is your architectural blueprint of how you built. And that information tells you where there's inefficiencies, potentially in how you built in your biochemistry, which we never guess. We always validate. If I think looking at your architectural frame or plan, literally that the inefficiencies that the genes are suggesting to me are something I want, or excuse me, let me back up. I look at your wireframe or your blueprint to see whether the inefficiencies your blueprint is showing me actually match your story. So that's what's really interesting. What is
Yeah.
your story? What is your ask? Can I, by reading your DNA, get an understanding of where some of the inefficiencies are, and also where you've got real winners? And if I see that overlap, before I do anything, I'm actually going to validate it in testing. So, and from there, I'm able to put all these information together, your story, your blueprint, validation from the labs to kind of validate what backwards to you. That tells us how to implement precision nutrition with
Yeah,
no
absolutely.
guesswork,
Yeah, yeah,
right?
yeah,
So
yeah.
it
And
is.
it's just so exciting. I mean, you describe it. You're so much better with the words. Sometimes, you know, yeah. I mean, you described it perfectly. And this is for me as well. And when I used, you know, first for myself, you know, I was the guinea pig, I guess, you know, many years ago. I was thinking the first thing that I did, it was just trying to see, like you said, how this information was matching my story. And I was surprised, and I was like, oh my God, you know, if I had all this information many years earlier, I wouldn't have suffered so much. As simple as that.
And you wouldn't have spent so much money either.
Well, yes, definitely, definitely, because sometimes people, well, and going, yeah, when nutrigenomics or nutrigenetics tests, sometimes they're expensive. That's what they say. And this is, you know, what the argument of some people could be. Oh, I don't use them in my practice because people think it's expensive. But actually, the kind of money that you might end up spending, and also being guided into directions that might be not so good for you as well, doing things that
100%.
could potentially even harm you, you know. And, you know, usually okay, it's difficult to happen, but sometimes it can happen. If someone has, and I don't want, you know, maybe discuss like a specific example, something that the last few days I was discussing a lot with, you know, a lot of clients and also practitioners about HRT and how it can be used in a way that is useful for someone, and how
Mm-hmm.
you can use nutrigenomics with, you know, having the information from these tests to use HRT in a way that is beneficial for someone. Because
Exactly.
it's not like, okay, I take HRT and it's going to work for me and it's going to cure. It's, you know, an absolute solution for everyone, because this is
No.
not the case. I mean, what is your opinion, especially on HRT, for example?
My opinion on it is, so, and you and I have talked about this. It means I
In relation to
use,
nutrigenomics. Yeah, I
yes,
mean, how
open the
would you,
Nutrigenomics.
yeah.
I would actually use it to understand. Well, first of all, we got to look at our scope of practice, right? Neither you
Sure.
nor I are physicians, so
No, no, no,
we're
no,
not
no,
going
no,
to
no, no, for
recommend
sure.
one way or another. But we'll use nutrigenetics, and I think there's some companies have really powerful reports that we're using to look at this, to understand. Actually, even before you take HRT, how you make and how you detoxify estrogen, progesterone, testosterone. Some
Mm,
people will tell you when they're given progesterone, it's usually the first one that we lose, right, as women, and it's often the first hormone that is prescribed. Here, just take progesterone. That's vitamin sleep. You'll feel better. And an X percentage of women feel absolutely dreadful on it.
I
We're
was
able
one of
to
them.
read. Yeah, right. It
I
is like, we're so like,
absolutely
oh my
dreadful.
God, you poor things. And no, I would say it's a lot larger percentage of women than we think, because progesterone is active and it's got some pathways it can go down, right?
Mm,
And if you're not able to basically to metabolize it or detoxify it, it can send some women into orbit. It can send your cortisol through the roof, right? It can back up. It can just be miserable. And if it's being prescribed, or even estrogen, estradiol, is being prescribed without us understanding the passage of it into the body and through the body, particularly
mm,
detoxification, it can, as I say to some women, absolutely orbit you. And that's the
agree.
difference that we can see in nutrigenetics. It's like and I want to talk about this a lot, like, you know, particularly in
Yeah.
midlife with women that, you know, sometimes we're using HRT and it's a miss for what women actually need. We're using it to tackle too many problems and we're causing a lot more at the same time. So to answer your question, nutrigenetic testing, once again, it's your blueprint. Here's your story. What's your blueprint? Hey, before you consider that, can we just validate how your body is built, how it might detoxify, utilize these substances? And can we cross-validate that with a test where we can look at metabolites that are associated with testosterone or estrogen or estradiol, you know, how it's
Mm,
detoxified? Because there's so many genes involved in that. And once we get that picture, we know how to support you if this is the route you're going to go on.
yes.
Otherwise, I'm going to tell you, it is absolute guesswork, and we just hope it works.
Yeah, I absolutely agree. Yeah, we're not physicians, and of course, you know, we're not going to advise someone of for or against, but it's about information, and it can make a huge difference because it can, you know, changing your dosage. So, you know, how much you take, the potency can change, the
Yeah,
frequency can change, the timing, you know, when to start, for how long, a lot of factors that you can actually modulate to make it beneficial for you. Otherwise, it
exactly.
can make you very miserable, or
Well,
give you
yes,
very little benefits. You know, you might taking it and not actually getting any benefits from it. Just, you know, being, because it also depends on how sensitive, you know, your receptors, for example, how sensitive they might
exactly.
be to that. So you might be getting it and you think, oh yeah, it's okay to protect my brain and protect my bones, but actually it's not working that well on you. So it's a lot of like issues that need to be considered. Do you want, I don't know, do you want to bring some other examples that you see more frequently in your practice? How we can use as practitioners, how we use as practitioners nutrigenomics to help someone with, you know, their health or their challenges.
Yeah, what I'm seeing so much. So I think you and I have an overlap in our populate, you know, that the age brackets of our populations. But I work a lot in midlife with midlife, male and female, or individuals with a lot of unresolved, but apparently unconnected health issues. But I will tell you, the mental health space, and we got to find or health optimization, feeling better about yourself space, is huge. So what I see, the most powerful thing that I'm seeing in my work right now is in the midlife time when people's brain hormones are changing or neurotransmitters are changing. So many people are struggling with emotional wellness. They feel their life is absolutely like something has happened to them. I'm also seeing with young people too. It's almost tragic to me that when somebody who's in their teen years or early 20s is saying, I feel manic. I don't even know how to show up in life. And literally, so we're looking at 3 different population groups. Being able to look at what we call neurotransmitters, how someone is producing and detoxifying serotonin, GABA, and also dopamine is life-changing to me. And I'm using pretty advanced reports just like you, but I'm telling you, we can make such a difference because we can literally see where somebody cannot break down dopamine, why they feel like they are, or if their serotonin receptors are really, really sensitive, how the world is so overwhelming and chaotic for some people.
One of them.
Yeah, you're one of them. Yeah, I mean,
I bring those examples. Seriously, I am one of them, and it's really I've struggled. And actually, what helped me mostly with nutrigenomics, and sorry if I interrupt, but this is very close to my personal story. It really helped me with my mental health. I think that was the first benefit that I saw from that. Just trying to understand what I could do, beyond therapy and everything else, which is also very helpful, but what I could do at the physical level that could also affect, for example, my neurotransmitters and how I respond to them, which, like 15 years ago, I didn't know, I didn't understand it. To me, I wouldn't think that how the physical aspect could affect my mind.
Oh,
But
yeah.
actually, it was huge, a huge difference. I was suffering with anxiety, severe depression. At some point, I was even diagnosed as, bipolar or whatever.
That
Which
comes up a lot.
I'm not, but probably borderline. It was difficult for me, and I'm so glad that you mentioned that. First of all, I would like to say thank for everybody that is joining. I don't know from your side, but I can see um, Kim has joined. I'm so happy to see you here, Kim, and Tessie and Elise and Eva. I don't know if any of you, well, Kim, she is a practitioner. I know that. She doesn't use nutrigenomics in practice yet, but maybe she will. If any one of you guys use nutrigenomics in your practice or want to use nutrigenomics in your practice and you can't because, I don't know, you've done the training and you still struggle or you haven't done any training, just let us know. I have a question though for us. So about gut health and osteoporosis, how we would use that in our practice using nutrigenomics. I mean, I do that. My signature program includes DNA testing and my signature program for osteoporosis for bone health. But how would you use it? How, what are the aspects of a nutrigenetics test that you would like to see
Yeah.
to help you with that?
Well, this is a passion area again for both of us because we both live with or have lived with osteoporosis. You're like, well, you're fit and you're healthy and all the things. How can that quote happen to me? And what I will say, and I'm going to answer the question, is when you work with DNA testing or nutrigenetics like you and I do and have done for a long time, you start to pick up in patterns in the genes that give you a different insight into what's going on. So for me, oftentimes when I'm looking at the topic of osteoporosis, what is trending that I see over hundreds of tests is I'm going to look at methylation, believe it or not. So this is
very much.
really
No, that's my number one. I agree.
Number one is methylation because we look at to optimize that cycle, and we have a lot of information in genetic tests as to how optimal that is. And of course, we validate in labs, so we always look at methylation. Vitamin D is like it almost gets a cursory glance for me because pretty much, at least in my world, most people need supplementation for a number of different reasons, even if they're out in the sun all day. So that's a kind of a more minimal part. I'm also looking at things like, of course, inflammation, oxidative stress, and what shows up for me so much when I'm looking at genetics and then I'm looking at the labs is LDL, so oxidized LDL. She's saying, well, that's not on a
Thank you
test.
very much. I'm doing a video about it tonight. That's so interesting. Oxidized LDL. I'm so glad that you
Yeah.
mentioned that. Yeah,
And it's an inflammatory marker. It's
it
not
is.
that your cholesterol's all messed up. We're looking at it as a sign that your cholesterol is it's, you can call it what, an acute phase reactant. It's going to go and help um, kind of soothe or protect a site, if you will. So think of it as trying to be protective, but in fact, it's not. It's actually pro-inflammatory. And so then you say, well, why is that happening? So then we go back and look at hormone balance. And we can, again, we're back to, okay, we're looking at hormones, hormone production and detoxification in a test. So it's not that we just look at, oh, this is what's happening, eat this, do that.
Yeah, it's
What
not.
genetics
It's not.
does is it gives us
Mhm.
patterns. Here's your story, osteoporosis. You never get a genetic test. Here's a panel on bone where you can see bone health.
Yeah,
But what we're looking at is multiple
it is
genes
multiple. Yes. And I'm
and
so
multiple
glad that you
pathways.
mentioned that. Yeah, I'm just so glad that you mentioned that because, of course, you will see some things, on collagen, some when you see the DNA test, if it's like a pretty comprehensive report, you will probably get some information on things like collagen and vitamin D and
Yeah.
vitamin K, which are also very important, but it's just
The,
part of the story and it's the expected ones. And probably when someone who is not very I don't know, experienced maybe with using nutrigenomics, this is the first things that they would look like, and maybe not much else. But the things that I look, like you said, oxidative stress, inflammation. So what happens with inflammatory genes? Because inflammation is going to feed bone loss. Also, what happens with hormones in general, especially estrogen. What happens with estrogen receptors is super, super important
mm-hmm.
because you can understand why this person that did everything right, their genes, as far as it concerns the vitamin D and the vitamin K and the collagen is okay, but they still got osteoporosis and quite advanced. So why it happened? And then, like you said, you see other things that might be happening. It could be something going on with the thyroid. It could be
Mm-hmm.
something that with the estrogen receptors being not so sensitive or too sensitive without the person having. So if you have someone who has ASR1, the main, let's say, estrogen receptor, who is very sensitive to it, and you have someone who, for some reason, because of the diet, the whole life, low fat. I was on a low fat diet for like 20 years, in the 80s, it was everything that was low fat. So if
It was.
someone, if a woman, yeah, on a low fat diet for like, teenage years and then in her 20s, she's going to have low estrogen. If the estrogen receptors, ESR1, is too sensitive, this is going to have a huge impact on her bones. For someone else, not so much. And maybe she's doing everything right, and she's doing exercise, and she's taking supplements, and she's not menopausal, and she doesn't really have any other problems with her genetics, about the bone issue, that triggers a bone
Mm-hmm.
stress and a bone problem, but they still have osteoporosis. And what, because of, something that happens with estrogen receptors or something that happens with the methylation, or because vitamin D is not absorbed at cellular level, which is another thing that can happen. So you see your tests, your functional tests are okay, your vitamin D levels are normal or even high, but actually it doesn't go into the cells, or it doesn't travel. The transport of the vitamin D doesn't go to the rest of the body. So these are the things that you look into, into the genetic testing. And to answer, and if you want to add something here about the gut health, because somebody asked me again today on gut health and nutrigenomics or nutrigenetics test. What we, with a nutrigenetics test, you can't really see what happens in your microbiome. You can't see that, but you
Mm-mm.
can see, the food response, how you respond to certain nutrients, to certain foods, and that can give you information about what might be happening in your microbiome as well. So I find this very, very useful. This is information. So it doesn't, if you want to have a test on your microbiome, you do a very good stool test, a comprehensive stool test or something similar. You don't do a genetic test, but the genetic test will also give you some information of what is happening in your microbiome from the food response as well. I don't know if you agree, if there's anything else that you
Yeah,
think.
yeah, I do. And it's interesting. I know somebody just asked you, what is RDN? So I'm a registered dietitian in the
Yeah,
United States. They put an N, nutritionist, after it. Half the time I don't even put the credential, but yeah, I'm trained as a dietitian, but my expertise is like Maria, nutritional biochemistry and genomics. That's the field of science that we're operating in, so precision nutrition. But yeah, so again, answering your question, yeah, you can't use a genetic test to evaluate the microbiome, but what we can see is things like whether you're able to produce bile efficiently.
Yeah,
So bile helps you with fat digestion. It can give us a tiny bit of insight into the makeup of your microbiome, but it's at a real macro level. And I would never say, okay, foot two, secretor, non-secretor.
yeah,
That's,
I agree.
that's why you have issues. There are some really neat things that we looked at. Maybe we'll talk about this in Greece, Maria. Like we can
Yeah.
look at very specific genes if there's any practitioners listening. HIF1 alpha and PPAR gamma, they are genes that work together that if they're in the off position, it can change like the environment of the gut to being aerobic. And you think, well, okay, what are they talking about? So your gut and the microbiome, the bacteria in your gut prefer an anaerobic environment, which you think that's not consistent with life. But there it is. You want to grow the beneficial bacteria, and they prefer this anaerobic environment, and that is very, very protective of the gut lining, the immune system. So if you have a gut environment, or genes are a little bit like, I call them like the noisy kids in the neighborhood. They really shouldn't be, or they just moved in. You're like, oh man, it was nice before you guys moved in. Sometimes we can look at genetics and ask you questions and know, yeah, those genes are really not operating optimally. Okay. And then we start to correct the
Yeah,
digestive environment from the gut down, right? Like from the stomach down.
And something else that also, gives you information about the microbiome, and not exactly what is happening in your gut, but if you see things like lactose intolerance, for example, genes related,
Mm-hmm.
lactose intolerance or gluten intolerance, again,
Yeah.
from the genetic response, that probably, and then of course you look at somebody's diet at the same time and you know what is happening. Well, that probably leads to a very good assumption that, well, maybe something's not going on very well with your microbiome, because if you are having these foods and there is genetically, there is some primary intolerance, then you probably have some level of inflammation or low grade inflammation happening in your gut anyway. So there is information that you get on your gut that could potentially also absorb even further how you interact and how you absorb nutrients that you can get from genetics. But it's not
Sure.
really a microbiome test. If you want a
Yeah.
microbiome test, then, you go and do a functional test. But you still get some information. And this is, how I would love other practitioners and nutritionists and health professionals to use nutrigenomics in the practice, because what we're talking here right now is about patterns. For example, if someone has an autoimmune condition, or if someone has osteoporosis, or if someone has a thyroid problem, what I see with practitioners that do the training is that, okay, so I will do a thyroid report, just look at the thyroid only. And I'm not saying that this is wrong. Of course, if you look at the thyroid report is going to give you the most information genetically that relates to your thyroid. But you have to look at the whole story of the person and then make a decision. What else might be needed? You might also, well, probably if you have a thyroid issues, you might need to look at your methylation as well. You might look at, how nutrients or foods affect your gut as well. Other issues,
Mm-hmm.
not only the thyroid. So
Yeah. Yeah.
and this is the kind of work that, I know you do and I do, and I'm really passionate about. And I think that's one of the reasons, one of the reasons that practitioners are struggling. I don't know, what do you think?
When you say one of the reasons the practitioners are struggling, like because the test is
Because
difficult or they're not quite
it's
sure where to
like,
look.
it's narrow, like, they think very narrowly. And
Okay,
they go
yeah,
like, okay,
yeah.
someone has a thyroid problem,
Must
and
be the thyroid.
it might be the thyroid only. So I'm looking only at the thyroid report that gives me, like 1, 2, 3,
Gotcha.
4, 5, 10 different genes or whatever. And it's
I
very,
gotcha.
they go like,
Yeah.
almost ignore, or they don't want to see other things.
Yeah, no, and here's, I mean, because you and I teach practitioners all over the world, and one of the things that I know I teach is of course every single individual we work with is unique. They all have a blank canvas, right? If they don't, I mean, it's a very colorful canvas. But when an individual comes to see me, I'm not going to look at a test sort of one panel at a time. What I'm looking for in a test is I'm looking for patterns. What can I see in different areas of the test? And the reason I'm saying that is because usually the answers to an individual's health issues are actually in like the dark spaces you're not looking in. And you're like, well, what is she talking about? That maybe, like you and I have talked about, the fundamental issue behind osteoporosis has nothing to do with the tissue matrix at all. It actually has to do with inflammation or oxidative stress. When you bring those things online, the gears of biochemistry come back online. So I guess one way to think about it is our work is to look for patterns and figure out which patterns are offline in the body, right? And how do we bring them back online? That then will optimize the thyroid. So it's not about, oh my gosh, the thyroid, the TSH is out of whack or their T3 is low. That's the end run. That's what's happening with them right now. Our job through genetics is to try and figure out what caused that situation, what caused the interference. Is it the microbiome? Is it inflammation? Is it immune dysregulation? Yes.
Immune dysregulation, happens a lot, and especially with antibodies. I mean, as Colette here says that, Colette says here in the comments that she's been told that her thyroid is perfectly okay even with thyroid antibodies. Well, I wouldn't go that far to say that your thyroid is absolutely okay even with the thyroid
reacting
antibodies.
To something,
yeah, because your immune system is shouting there. It's just screaming a little bit. Something is not. Yeah, but yeah, it's true. I mean, having just looking at just one thing, especially as far as it concerns the thyroid and Hashimoto's, I mean, I don't know, it's becoming such a common thing. A few years ago, like even 10, 15 years ago, it wasn't, especially in Greece, it wasn't that known. And now I'm here, and I would say 5 out of 10 of people that, come to see me, like 50% of people have Hashimoto's.
Oh, 100%. It's the diagnosis for everyone. Yeah.
Yeah, I know. I don't know. But yeah, I mean, I'm just so glad that you're saying all these things. And something that I thought, when we were describing the situation about the thyroid, similar with osteoporosis, everything, genetically could look okay as far as it concerns bone. And one of the things that I see, especially with early osteoporosis, and I see with athletes a lot, because this has to do with oxidative stress, and athletes sometimes because, well, it's a lot of effort and a lot of training. So they do create a lot of oxidative stress, which is byproduct of our metabolism. So because they use a lot of energy and they use the bodies a lot, and there is a lot of effort and a lot of training, they actually also produce a lot of oxidative stress. So people that are younger, and sometimes athletes that have early osteoporosis, osteopenia, they have some problem with the GSD1 gene or with the glutathione, which is one of the master antioxidants. I don't know if there is research about it, but I don't think there is not one single person with early osteoporosis, especially with some form of athletic background, that had early osteoporosis and didn't have a problem with glutathione in their genes.
Well, it totally makes sense. And if you have a GSD1 deletion, which is very high frequency. We see that a lot. And then if they have multiple genes, here we are as practitioners, so they have multiple genes, they're involved with recycling glutathione to the reduced active form, then the amount of oxidative stress that's going to build is huge. The other thing we see with athletes too, which is fascinating, because one of my partners works, Sarah Amadon works with elite athletes, looking at cases very common with our really elite athletes to have depression or mood disorders, anxiety, depression, and that is going to looking at methylation. So you're sitting there saying you're on top of the world, you're making money, or maybe you're not. It depends what sport you're in. But they're in optimal shape, and they're like, why do I feel like I don't want to get out of bed in the morning? The demand on your system with oxidative stress and methylation, everything in the body is shared. You don't have, okay, this is an isolated pathway called the thyroid, and this is your heart, and this is your brain. It's like, no, they all talk and work together. And I think genetics allows us to see how the language is shared, right? And where there, as I'm saying, where there's under-resourcing in the body, because as an athlete, there's such stress and such a demand on things like methyl groups or whatever the demand is, that there's not enough to go around. And the brain or the thyroid or your bones are going to say, excuse me. So I'm with you on that one.
Osteopenia and osteoporosis, well, osteopenia mostly, it's actually very common in athletes, especially endurance athletes. That do marathons or tennis has also, a lot of hours usually. And I see that, quite a lot more often than what you think. And you see it, even very known athletes, especially in tennis with stress fractures, like, young people, 25, 22, with stress fractures all the time, especially women, but also men. So it's something that you think it wouldn't happen because they look fit, but actually the nutrient and calorific needs don't actually match their intake, or the intake doesn't match the needs. It can happen very easily, if you're hard training, or, if you are running around, traveling different countries, going to different events, it can happen very easily. I'm sure we could be discussing about these things for like 3 hours. So
I want to tell. Go ahead.
Oh my God! Yeah. I mean, sometimes we have like Zoom conversations, and we end up, talking for hours and hours. For practitioners, what is the number one challenge? What do you think it is? I mean, one is patterns for sure. Recognizing patterns, which is something that it doesn't really come as part of a basic training. We know that.
No, not at all.
What would be the next one? Let's say the number two, maybe, reason.
Yeah, definitely patterns, how to look for patterns and tease them out. Then the next thing is, because we deal with a lot of information and we compute a lot of information, how do you create a care plan, if you will, or a strategy that is, number one, not overwhelming for the client, and number two, doesn't have a bunch of noise in for you. So another way of looking at that, and this is when I'm teaching practitioners, how do you create the best return on ingestion, so ROI, for the patient in front of you, right? Because genetics is a ton of information. When you can see patterns, you know how to pick out the heavy hitters, organize them, and then say to the patient, and this is hard for the patient or the client, it's like, we have this much information, but the only thing we're going to focus on for the next 8 weeks is this. We're only going to bring this online. There's a ton in your report. You and I read a lot of reports from around the world. There's this much information, but as a practitioner, you want to take this much, where the patient gets the best return on the money they're paying you, or the money they're putting into themselves in terms of food or exercise or therapy or whatever. That's the hardest thing for practitioners, is how do you boil it down and be honest with the patient, say there's a lot going on here, but this is going to get you from 0 to 100 a lot faster. And we're going to leave all of that. That's next year's work. That is a business strategy. Okay. It's both business, but it's also the talent of a practitioner that's balancing the science with the art of what we do.
Yes. So you're making things practical and, well, not only practical, but you said prioritizing in a way.
Prioritizing.
Know how to prioritize. And you said, you prioritize and then you leave the, some things for, I don't know, later. What I find very often is that when you prioritize, because our bodies are so dynamic and so, all systems are interconnected. When you prioritize on the things that, you need to, and you work on that, and of course, the person also is following your advice, and you see the benefits of that. You also see the other things shifting as well, because it's everything connected.
Exactly.
So a year later, you don't need to work on the other things, because
Exactly.
things have shifted naturally and everything is interconnected. So that's what I see. So you work, for example, I mean, I'm just using my example because, it's easy to use, and I can use it because there's nobody's, personal data, I guess. But in my case, I was working on, my bone health primarily, but my mental health also improved.
Of course. Yeah.
Sleep, my physical, my physically, how my body feels physically. I used to have musculoskeletal pains. I was feeling tired, everything, but I didn't work on all of it
All
at the
the
same
things.
time.
Yeah.
I just focused on one thing, but everything else just started shifting, because that's how the body works. And it's very important for people to not get lost with the information. And
Yeah.
unfortunately, that's what I see. People get overwhelmed. They get the genetics report, has a lot of information. And then on the other side, they have, the person's routine and what is happening in their life and the medical history. And then on the other side, they have the functional tests. And they go like,
They get,
oh
yeah.
my God,
I know.
what did I get myself into? I don't want
and
to do
imagine
this.
being
I
a
don't want to do
patient.
it. Yeah, I
Yeah,
don't want
it's
to do
true.
nutrigenomics because it's just so
And
complex.
it's actually,
And
if you start with that, it helps you
exactly.
get through all the
And
noise, right?
the noise, exactly. And if you don't, and I appreciate that a lot of the trainings out there are absolutely amazing, but there's not enough time. And most of, a lot of them are just online. Some of them are not online, so you can do them in the lab. There's not enough time to actually do this sort of work, to be honest.
Exactly.
You have to start with the basics, but this work is necessary, because otherwise you're going to get lost. And you get lost, and you also lose an amazing opportunity as a practitioner to actually stand out. Not only,
Exactly.
in terms of the business side of things, because everybody goes like, especially, my UK friends and practitioners that go like, oh yeah, I've done a training, but it's too, it's difficult. It's actually quite expensive. And I don't know how to, to communicate that to my clients, because they don't feel like, it's worth it. But the problem is not the client doesn't feel that it's worth it. They don't feel that it's worth doing it because they don't have the confidence. And if the client feels that you're not confident about what you're trying to sell to them, of course they're not going to buy it, because you don't have the confidence to actually say, this is what I'm doing, and explain to them what the benefit is. Because the client at the end of the day doesn't care if you do it using nutrigenomics, if you do it using,
Get
I
me
don't know,
well. Get
magic
me well.
or whatever. They just want to feel better. Yeah, exactly. If you do it, well, the majority of clients, seriously, they don't really care. If you do it using nutrigenomics or some form of testing or crystals, I don't know, they just want to feel good. And if you believe in what you do, and you know what you're doing, and you know that you can make the difference, and you've seen it in yourself and you see it with others, and you're able to communicate that to your client, the client will pay you, will find the
Yeah.
money, will pay you. And I've seen it that multiple times. And of course, in this case, it's a lot of knowledge, it's a lot of effort that we put in. And this test also has some costs, and the laboratories also do some, very, very detailed work. So yes, there is some extra cost, but actually, is it a cost or is it an investment? And
Yeah.
it's the kind of conversation that a practitioner needs to have the confidence to have with their patient, and the confidence to have as a message, in the practice. And this is the other kind of training that somebody needs. It's an on
I
top of the
agree.
business side of things. So it's not only understanding the nutrigenomics, but actually get the business acumen at the same time of how you can build that into your business in a way that, it doesn't drain you and it makes sense to you and it is successful and also helpful to others. You're not out there to steal people's money, but you're
No,
not out there to be undercharged as well. As simple as
exactly.
that.
Exactly.
We spend years and years and years of trying to understand patterns and training, and we spend money as well in all these trainings and conferences and our time. Time is something that cannot be returned. It's worth a lot more than money, and we love this stuff. It's not that we regret anything out of that, but I mean, we deserve to earn as much as we invested into this thing. So
Exactly.
yeah, I mean, we can't be undercharged, and unfortunately, a lot of people, I think, um, they don't really, they do that. They don't charge enough, and you feel it. You feel it in your bones, literally. You feel that, oh
Yeah,
my God, I feel
exactly.
undervalued. It's not only undercharged, they feel undervalued. So they leave nutrigenomics out of the practice and they're losing the opportunity that can actually help them stand out of the crowd
And
and
also,
that's pity.
and also speed up the time to find solutions so you actually are more efficient and effective.
We're both getting very, very passionate because, I mean, at the end of the day, we also have a personal story, I guess, about that. And it is a form of I don't know, self-development, a different type of, different kind of self-development when you look into your genetic test. And that's the way that, that's the way I present this to my clients, because it is, it's not really about learning about your vitamin D levels or your vitamin levels or if you have
Mhm.
a tolerance or whatever, but it can become a very powerful tool for the practitioners and a very powerful tool for the client because it is a self-development tool.
It is. And, I just noticed Betsy, you saw Betsy listening in there real quick. She may be preparing dinner. I'm not sure right
Yeah,
now with our time zone differences. But,
exactly.
Betsy will be, one of the first. She's also a trained practitioner. She's
Yeah.
also used testing and seen, how transformative that is to inform a parent or a child, a parent working with their child or other people in terms of,
Massively.
it's just a game changer. And so for us, to me, I can't imagine personally, because of our scope of practice, not using it because I feel like I'm guessing or I'm running a bunch of tests to guess where's the aperture, what's missing. Um, and that's why we're seeing clients with tons and tons of supplements and they're not getting better. They're actually getting worse. So
Mhm.
that's usually who ends up on my doorstep is like help, and they've got all the labs. We know that, and a wheelbarrow of supplements, as I like to say. And genetics really helps us to get through to the why, or at least gives us a path that a client can identify with. So, yeah,
Mhm. Yeah.
nutrigenetics is it.
Things are game changing, and in my case, it was life changing. like Betty
Yeah,
said, we are game changing,
yeah,
life
she
changing.
said that.
And as far as you can say, supplements, yeah, definitely. I think a few years ago, especially with the functional medicine trends, it was all about getting lots of supplements. Well, streamlining your supplements is definitely something that you can do when you use nutrigenomics, and that's another selling point, by the way, for to sell to your clients. I mean, I take very few supplements now, if any. Sometimes I even forget them daily. Sometimes I see my sister
Don't we
taking the
all?
supplements, and I was like, oh yeah, I have to take mine as well. So I don't feel the need to. So how much money people spend on supplements that are poor quality, or it could be great quality, but they don't need.
Or they're
No.
over formulated, and
Or they're
that's the
over
scary thing,
formulated. Oh my God.
particularly if you're working with like
Oh my
emotionally
God.
liable patients, if you're working with
Yeah.
some ADHD, hormone changes, like some of
Oh
these
yeah.
supplements act like drugs. And so what I
Absolutely.
find so useful with nutrigenetics is to see where that sensitivity might be. As you know, if you're looking at acetylmethyltransferase comp, if it's slow, versus fast, that is a whole different experience in life for the client you're dealing with. I mean, how things happen in their life and how they describe how they process the world, whether they're dyslexic, whether they're able to follow multiple directions at the same time, whether their executive function is, they know it's right on and they're like, man, I just cannot be in a room with someone who's going to be 10 things to do because I cannot sequence them. We can see that it's not just one gene, but just we like to pick out comp, fast, slow. It's like coming up to an intersection, right? And do I turn left and do I turn right or do I go straight on? In the body, that's how it's perceived. And you cannot see that without
Absolutely,
the
absolutely.
genomics. So,
I totally agree. Can you explain what is needed to have genetic testing and what is the cost? We work, I mean, both me and Amanda, of course can answer that. We work with a lot of like different laboratories, and the way that I work specifically, I think Amanda is similar. When I look at the client and look at the medical history and everything, complete these forms, probably we have some conversation as well before. And then I decide what kind of laboratory to use on what report. So I don't make the decision before I look, at somebody's, first data, and
the
sometimes
story,
also functional, story, and also functional tests. So it's not really an easy answer that I can give you like a cost for that, because everybody's like different. But to actually do most of these genetics tests are mouth swabs, so they can be very easily done. You have like a tube and a stylus or something that you use. You scrub the inside of your cheek. So it's very easy to do. They can be transported pretty much anywhere in the world. There might be a few countries or some states, maybe in the States, that might be some problems sometimes, but it's not stool, it's not urine, it's not blood. So it's a safe sample and a lot stable as well sample that can be transported as well for people that work online like myself. And sometimes, for example, tomorrow I'm sending, one kit to a client in Portugal, and she's going to send it from Portugal to UK back to the laboratory for testing. So, things like that. Or, the other day was someone to Switzerland and somebody to in Belgium. So, if it's something that it's safe, it's easy to do as well, and it can be transported across different countries, and etc. As far as you can sense the cost, it really, really depends. I would say, and the number of the reports and the number of the genes that you need to look at, you're looking probably at a minimum cost starting at $250 plus.
minimum. Yeah,
Minimum.
I would
And
say
this
in your
doesn't,
mind,
that's
but
only for the cost of the test. So
right.
it doesn't include any interpretation from your practitioner, any work that we do, any consultations, any of the time. So that's just to take the test kit, do it, and send it back to the lab so they can do the report. Then you get the report, and then you're stuck if somebody doesn't do the work for you, because it's a lot of information and you can't really understand it.
And you don't want to order like what we call over-the-counter tests or just off the internet kind of
No,
tests. You
never,
definitely
never.
always want to know if the company you're ordering from, most of them that are reputable, you have to be careful with that. Most of the ones that are clinically relevant, where we know the genes have been tested and validated in the science versus being a bunch of junk genes, like, are you going to go bald early or whatever?
Yeah.
I mean, okay, that are useful but not useful. The most clinically relevant ones will not be sold directly to you. They're called B2B, so business to business. They actually come via a practitioner, so the results are released to a practitioner, so that you can have a practitioner who's trained in the space actually read the DNA for you. Because if you don't, it creates a bunch of hysteria. And what you start doing, what we're seeing is people start loading their genetic or doing one gene at a time into Chat GPT. And ChatGPT is not trained
ChatGPT.
to read genetics, no matter what you think, okay?
No,
Because we've
no,
looked at it. You know, it's not like here,
no.
load a report, but
I mean, you
honestly,
can use it. I mean, no, you can't do that. I mean, of course, we use it, and I use it, for my workflow and individually to look at
for
certain research
workflow,
and
yes,
gains and things like that. But definitely not to do the kind of
not
work
to
that,
read.
that we do. It can be particularly helpful, but not exactly for this thing. So how, I'm really excited about the kind of thing that we're doing now. So let's talk a little bit about that and how all the things that we said, what do we do with our program, with our retreat this October, and how we help. What is the difference between our training, our program, and all of the trainings? How we make the difference, how we help practitioners with all this information and all this overwhelm.
Yeah, so Maria and I decided to come together because we've been working at opposite ends of the world for quite a long time. And both of us training practitioners around the world. And what we're seeing the need for at a clinical level for practitioners is many have taken the training one way or another. All the trainings, pretty much all of them are done online, give or take in a couple of incubators where you're just learning things like, oh my gosh, let me just read this report. And you have no idea what you're reading. What we feel is missing is the opportunity to practice in a live session, learn together to learn how to identify key genes, identify patterns, identify how to prioritize a care plan, for example, go through case study after case study after case study, where you're learning to pick out the highlights from the genes, what they mean. And as we say in the Saints, how do you go from soup to nuts or A to Z? A lot faster so that you're efficient, you're effective for yourself, you're effective for your clients that you're serving. So what is missing in all the trainings globally is how do you do this in a way that's like we say, effective, efficient for you, so you feel confident, but is also effective and efficient for your business, your practice. And by doing that, it's actually efficient for your patients too, in terms of the money that are investing with you. And so what we want to do is work with practitioners who maybe you've just got your feet wet. You've just stepped into the genomic space. You've done a couple of trainings, but you're frozen. Like, okay, I'm scared to go the next step. Give me some tools that allowed me to have the confidence to open my door and say, yep, I offer genomics as part of the suite of tools and services that we offer. And so Maria and I are coming together. I'm going to be in Europe with you. I grew up in Europe, so I'm coming home, but I'm going to be with Maria in Greece on the island of Rhodes and doing this work to really help. It's like releasing beautiful doves. Like we want to release more and more doves, practitioners who will carry genomics into the world and say, this is a game changer for people's health. And that's what we want to do.
It's a big vision. And I think in the beginning of the conversation that we had, probably more than a year ago, it was about an online program or something similar. But then we both decided that the best way to do it is do it as a retreat. I mean, you run retreats, successfully now for many years, but not practitioner retreats. So having a practitioner program class retreat, because that would give the opportunity for someone to really immerse into the program instead of having an online program and then watch it and forget about it, or watch it and then get stuck with something, then life happens and never get back to it. It would actually work a lot more. So away from the stresses and distractions of everyday life, with fellow nutritionists in a small group of people being guided by a couple of people that have done the work and have been doing the work successfully using nutrigenomics in practice for, I don't know, more than 10 years in my case. I'm not sure for how long it's for you. I'm sure it's even longer, probably not, I'm not sure, but it's a long time. So that's what we wanted to create. Wonderful surroundings. Rhodes in October is amazing, by the way, but it's not going to be a holiday. There's going to be, some hard work, but I think Again, my personal experience, retreats can be extremely powerful and transformative. Um, they do have the power to do that, and that's why people like the big names like, I don't know, Dr. whatever, Dispenza, and I don't want to say names, but all these people, they do actually have a point, because when you are in a group of like-minded people in an environment that nurtures this sort of connection and commitment as well to what you're discussing, what you're learning, the kind of results that you get, the kind of learning, it's become imprinted on you. It's different.
Yeah.
And I have experience, personal experience with that. Again, there are a couple of things, nutrigenomics and a couple of retreats that I've done many years ago that literally changed my life. And I know that the retreat can actually have this transformative experience. It can be this transformative experience. And this is something that an online program won't give you, because
No,
you are
I
in the same environment,
agree.
you have the same distractions, and especially if it's not have a live element at the same time, it's just online, so you just buy something and then you forget about it. Like I said, you never use it. Unfortunately, that's what it can also happen a lot. So we created something a little bit risky, maybe, but very, very new. We're very passionate about it. It's on October 14th to the 17th, if I remember
Mhm.
right.
Yes.
And I think Betsy already shared the link for it, but we'll also share again on our Instagram later on. Yes, it would be lovely to see some of you practitioners that joined the live today. If you can see you there. I'm very excited about this. I'm very excited being back in Rhodes after more than 20 years. I don't know what you're
Wow.
excited about, but to me, it was amazing the first time I went there. It was very hot because it was August. Now in October it's going to be fine. But I really want to go back, and I have actually a lot of clients in Rhodes, which
Oh, that's
sounds crazy,
wonderful.
but I have quite a lot of clients in Rhodes. So I'm excited about getting back to Rhodes, and of course, meeting you in person, because we never met in person.
I know. We've just been
Yeah, we
working
worked
on.
together for a while, but never met in person. But what you're excited about the
Oh, I
retreat?
mean, growing up in Europe, just any time to come home to Europe is like the first thing, like putting my feet on the ground, being in Greece, looking at the environment, the beautiful environment of October is a very special time. But I think most of all is knowledge is power and power is knowledge. And to be able
Mm,
to empower a fellow to colleagues to say, do this. And we're gonna be side by side with you. We're going to
yeah,
put our arms around you. We're going to mentor you. And we're not going to let you go until you say, yes, I can do this.
yeah,
But I also think for practitioners, who many of you will listen to this later, is not only are you going to feel nurtured in many ways, because our retreat's all inclusive. So yeah, the hotel's in there too, and all our
yeah,
teachings, but we're also providing tools very specific to this retreat. You can't get them anywhere else, including
mm,
pattern recognition tools, which is what's missing, like just a little
yeah.
bit of
Good.
interactive
And
software for you and tools.
yeah, it's very
That's
important. And how to
cool.
use AI. There's going to be some introduction with that, because to be honest, especially as per concerns workflow, it's really helped me a lot, because at some point,
Mm-hmm.
I was feeling that it was too much, and I started. I had someone working for me, but yeah, AI. It actually simplified things a lot for me. It
It
saved a
does,
lot of
if you know how
time,
to use it.
and yeah, if you know how to use it, that's also can help a lot. And depending on the time, we will give some help with that, which I think is going to be very helpful, especially for people that have been practicing nutrigenomics for a while. But of course, the food and the sun and
Oh,
Greece.
yeah, the future
And
son.
we're going to have an excursion as well. And there are going to be some freebies. I was talking to some people today that are dying to, we have like a nice goodie bag for everyone. They're dying to give us their stuff to share with our group, which is great. And yeah, I would love to do more than that. I would love to, to join us. Thanks again for everyone that have joined, and thanks very much for people that are listening later to any recording.